So we have two answers I want you to tell me, E and D. Dilation of the aortic root is what? It's Marfan syndrome. Okay, so this is in Marfan's. We take this out. Okay, good. This is how you pass the test in a short time frame, guys. I hope you know. Clicking the answer and moving isn't going to help you learn a lot if you know and realize your foundation is a little weak, okay? So we have calcification of the aortic valve is aortic stenosis. Some people have been reaching out to me, DM, thank you. So aortic stenosis, you think, what do you want to see aortic stenosis, right? So as you read these answer choices and practice, many of you do this, many of you don't. Those who don't come back to me 6 months later saying, hey, man, literally, hey, man, not even, hey, doc. They go, hey, man, I'm not passing. I need help. Well, but hey, man, you haven't been doing what I've told you for 6 months, so I can't help you now, right? You have to build your strength, and strength is confidence in basic sciences. Calcification, aortic stenosis. Now we have three. Asymmetric hypertrophy of the septum, fibrinoid necrosis of mitral valve, eccentric dilatation of the ventricle, left ventricle. What's the answer, guys? What do you think the answer is if we know it's HCM? So hit the key info, attending tip to confirm. This young man has just experienced exertional syncope. He has a harsh crescendo decrescendo systolic murmur. I hope you realize that HCM isn't just a young athlete passing out. There's family history. There's a genetic mutation component to it. There's also crescendo decrescendo, right? Where heard in the left sternal border, right? Also, as well as a fourth heart sound. So you realize many of you say, I want to click and go. I want to keep moving. When you click and go, when you hit A and move, that tells me you're doing multiple blocks a day. At that stage, yeah, you don't want to do what I do now because clearly you already have done your studying. Here is basically trying to cover everything and cover you guys to make you understand that when you're doing heart, lungs, or kidney, or any organ system, you have to maximize your return. If you're spending 8 hours a day, guys, 5 days a week, you should pass this test in 3 months or less. But the problem is everyone has different techniques and study habits and everything. So I've realized through all the people that I've worked with that covering the answer choices and not going back and bouncing back and forth in resources allows you enough time to focus on what's important and maximize your return. 5 for 1, right? So we have dilatations, Marfan's, calcification, aortic stenosis, eccentric dilatation, fibrinoid necrosis, asymmetric hypertrophy. Well, there's the answer. Now, do you know everything you need to know about hypertrophic cardiomyopathy? Maybe, I don't know. You could see here non-obstructive versus obstructive. I would focus time. You know why? Majority of doctors coming out from step one, all my doctors tell me, doc, I did well and they all pass. However, the majority, some of them, they have to study more because their scores are not there yet with the assessment tests. But the biggest mistake is also this here. It's basically that they don't understand the names of the conditions are not listed in the answer choices. It's actually a description of the condition. So that's why I push heavy on all of you to really focus on reviewing as much as you can as the answer choices, because those who spend time reviewing the answers not only strengthen their basic sciences, but actually strengthen their vocabulary when they say, well, I don't see Marfan's, but I see dilatation of the aortic root. I don't see aortic stenosis. I see calcification of the aortic root. By the way, the aortic stenosis, is it a dystrophic calcification or metastatic calcification? Put in the chat box. Is it dystrophic calcification or metastatic? You tell me. I'll tell you later what the answer is. Remind me to tell you the answer. Actually, look it up yourself. I'll look it up anyway, but it's dystrophic versus metastatic. One is D for dystrophic. I know the answer, metastatic. Which one is aortic stenosis? It's 50-50, guys. You either choose D for dystrophic and for metastatic. I'd like all of you to put the answer, please. Thank you. So the answer is, how come in this case, did you listen to the murmur? No, I didn't play it for you. So you see how easy it is sometimes to understand the condition without even listening to the stupid murmur? They're not going to give you something crazy. It's going to be something light. Trust me on this, right? Derek Patterson goes, dystrophic. Yes, man. Dystrophic calcification is the way to go. When you open up your first aid and dystrophic calcification, dystrophic, here we go. This is something that pops up always on your on your step one. Dystrophic calcification is for diseased tissues, disease for dystrophy, right? Metastatic, normal. So when they give you certain conditions, like, for example, schistosomiasis, rubella, toxoplasmosis, TB, calcified aortic stenosis, basically meaning anything that's damaged or diseased, you'll have calcium going towards it, right? Solidifying on it, versus metastatic is widespread. If you don't remember it, I mean, D for disease is good for me. The other way is M, switch it upside down. M is upside down W, right? Diffuse, meaning widespread. So they love asking these kind of questions. So we have to understand if it's high parathyroid, high phosphate, or sarcoidosis is going to be more widespread. These are the little details that will get you on the exam. So please learn dystrophic calcification. By default, the rest is metastatic. If you don't want to learn it, at least when you do the questions in AMBOSS versus UWorld, you'll be able to review the information. Yes? Awesome. Good stuff. Cool. So I just showed you here how you don't worry about the murmurs. Now, if you have AMBOSS, you can just literally click on, you could type in, aortic stenosis. Watch, you can say heart murmurs if you want, heart murmurs. Click on that. Opens up over here. You can do cardiovascular exam, and then you can listen to every possible murmur. They got imaging, echoes, EKGs, audio clips. I don't know why people aren't using this. This is like a one-stop shop. I know it's a lot, but do you want to go to YouTube and 10 different videos and some books? Like, I don't know about you. I don't have time for that. If I was you, I couldn't study more than 3-4 months every day. I'd lose my mind. Just being honest. That's why I care for you guys. I'm showing you ways and hacks to learn in a fast way. Now, if your foundation is poor, I'm sorry, but you can't hack the system. It's too in depth and too much. It's just too much, right? Okay. Another question, right? Another question. So I have these questions selected. I want you all to participate in the chat. Anybody wants to jump on live, please. I don't bite. I'm here. Let's read this in here. Ready? So now we have this one. Cardiac exam shows a loud S1. Okay. Which of the following contributes most to this auscultation finding? Now, I don't know about you. I hate these scenarios. They're so short. These are simultan BMEs. Don't get comfortable, right? A 30-year-old woman comes to the doctor, comes to you because of a worsening fatigue and shortness of breath for the last 7 months. She came from China 2 years ago. So, I mean, clearly the shorter the scenario, the more dangerous it is, the more difficult it is, because what happens is every word kind of counts, right? Versus when they give you like a large scenario,